everyone. आप सबका स्वागत है. And without wasting much time, I would like to invite Alakendu sir. He is the president of Indian Rheumatology Association, and we have had really good, 2 years despite all the COVID situations. He made sure that we all stay connected, including a lot of education programs, lot of on patient fronts as well. Alakendu sir, welcome, and we would be happy to have some words of wisdom and encouragement for not just the patients but the support groups as well.
Thank you, Avinash. This is for the first time, possibly in such a wonderful way, we could manage to organize such a group meeting with the patient and patient's family and support group. That's really a warrior program. And we thought, we always felt that we need to have this type of program in our forum. And until and unless we have this type of outreaching and the concept of therapy involving the patient and patient care group, we cannot move forward. For that reason, we took up the issue. And Avinash is the prime mover, along with Raj Kiran and our president-elect and scientific chair, Dr. Dharmanand. So we could make it possible by you people only, patient and patient support group, to have this type of composite program involving representative from all the groups. So we have planned to organize 6th, 7th, 8th, 3 days program, and that's really an innovative one. We can hear from you, we can plan what are the unmet needs and how to go ahead for therapeutic strategy, for supports, and what are the things. Like in Lupus Initiative Kolkata, we have already formed a platform by the patient for the patient. More than 10 years, a decade has already initiated. More than 500 plus patients registration done. They have an identity card. And we from the office, with the support of Mrs. Shubhra Ghosh, who is taking the care, and the patients are coming, getting all the medicines like mycophenolate, like azathioprine, like cyclosporine, and like corticosteroids and other things. And we could manage to provide 50% concession to the patients, in spite of the fact that majority of the medicines are free of cost in West Bengal Government Hospital. But as you all know, there are a lot of administrative hassles to collect all those free medicines. So some of the patients eager to come here and to collect the medicine because they can get 3 months medicine, nearly 50% off, if more than that. And during pregnancy, if a lupus patient is conceived, we provide free of them. During that 9 months period, they get all the medicines free of cost, and they feel really very glad, and we feel also really glad. As in our inaugural program, our chief guest was telling, this could be translated in terms of Sheva. So we could feel that, yes, we are doing something for the patients, and that's really justification of our existence as an organization. And with the card, identity card, patients are also getting 50% concession in investigation in some of the renowned laboratories in Kolkata. That's also another big achievement, because you are getting your autoimmune panels, ANA, dsDNA, and extractable nuclear antigen, something like that. As you all know, they're really costly, and they are being provided. And they also extended their hand in this support forum that they wanted to do something positive for the patient as well. So these are some of the things. We had a plan to do something for the children of the lupus mother, and to have some rehabilitation, physical, mental rehabilitation. We are organizing regularly physiotherapy workshop with support from the patient itself, and they show the exercises and others. They are giving some mental supports with a psychiatrist, psychotherapists, along with some of the patients who are really learning. So we thought, and we are trying to organize that one patient who are really stable at present doing normal activities, if she can catch hold of 5 patients who are not doing well, and if one patient into 5 patients who are not well, if we can gradually extend the concept, so patient will support the other patients. And that's really an achievement. It's not the medicine which gives enough relief. That's hardly 30, 40, maximum 50%. Rest 50% supports from the family, from other patients who are doing reasonably well, who are having normal activities in their society, who are contributing in a positive way. And if those patients can motivate other patients, yes, you can have this normal life, in keeping the disease at your back. So that's really a wonderful journey. And for that reason, we conceptualized this concept of patient support group. And we were planning repeatedly, but we could not make it. But this time really in a big way, with support of these people from Indian Rheumatology Association. I really thanks all of you. And we need good positive support from all of you and input as well to have a very constructive journey from now on, so that in future also Indian Rheumatology Association along with the patient support group could be a really exemplary platform for other organizations to follow. Thanks a lot. These are some of my observations I thought to share with you. And we have patients who are already have sent their informations to this forum so that all the patients group can be accommodated and collated, and we can organize this type of things in future as well. Thank you very much.
Next, I would like to invite Mr. Roy.
Yeah, good evening, everyone. Good evening, doctors, leaders, patients, and all caregivers. For the first time, the content has been co-created by the patient support groups and the rheumatologists for the prestigious IRACON21. This has been possible because the patient leaders and the doctors have been working together since the last 1 year plus. Dr. Ghosh was a speaker at the very first combined groups event in October last year. This 3-day event focused on patients, caregivers' perspectives, besides sessions on research, ergonomics, and insurance rules. I request the patient support group members, the leaders, to introduce themselves briefly, starting with Ms. Deepa Mehta of Mission Arthritis India.
Thank you, sir. And in fact, I would like to say that we have been called like in last couple of times to attend IRACON, and we are really grateful for that. Let me come to Mission Arthritis India. Mission Arthritis India was formed around more than, it's like 20 years now. Probably it was registered in the year 2002. It is registered as a society under the Public Society Act, as a trust under the Public Trust Act. And the main purpose to start with the patient support group ever before 20 years, I think it was the first of its kind, a patient support group for the patient of arthritis in India. So the main aim was to come together, share the knowledge, share the scientific and the management with arthritis. Also, again, I would like to say that we are grateful to say that my Mumbai branch has started, along with recently it is my Delhi NCR, and that's what we want to come together with all the rest of the patient support groups and move ahead from here. Thank you so much. May I please request Kirti Daoja to come forward, please?
Namaskar. Good evening to everyone. I am Kirtida Oza, the co-founder and director of Sjogren's India, which is the first and only support group which works for Sjogren's patients in India. Now we also have patient members from other countries who have joined us. Sjogren's, as many of you may have heard, is one of the lesser known of the rheumatic conditions. And we have been working for creating awareness and providing counseling support to patients and families for the past 15 years, started in 2006. At the moment, we have reached out to several other countries besides India. For patients who would like to reach us, you can look at our website, our Facebook page, our LinkedIn profiles, and we have a small presence on Instagram also. So you can reach out to us. More about the support group we will learn in the next session. I'd like to hand over to Neetu Vadhva of Scleroderma India.
Thank you, Kirtida. Good evening, everyone. My name is Neetu Vadhva. I am here today representing our group, Scleroderma India Trust. We are a Delhi NCR based group, but our presence is pan-India. In fact, Asia Pacific region, where we cater to patients from countries like Pakistan and Bangladesh. We are soon going to open our next chapter in Mumbai in a few weeks from now. In our support group, we have patients and caregivers together. We understand that apart from physical health, mental health is as important. Considering that we have a group of in-house counselors where they not only do group sessions, but group therapies and one-on-one counseling as well. I would like to talk about one of our projects, Project Upchar, where we cover the underprivileged with the subsidized rheumatologist consultation fees. Along with this, we have taken up the task of providing them with monthly medicine. Understand that being a support group leader is challenging with our prevailing conditions. To take this challenge a step ahead, I have done a certification program, which is from an organization working for Scleroderma, a Canada-based group. It is unique and one of its kind in the world, and the only group which trains support group leaders in the world. This has helped me in understanding things better. Our other support group leaders are also enrolled and would complete this certification in due course of time. So that was all about Scleroderma India. Thank you, doctors. I would like to pass it on to Vachas Amrita from Lupus Trust.
Good evening, esteemed doctors, patient leaders, dear patients, and all our viewers. I am Vachas Amrita, the co-founder and joint secretary of Lupus Trust India. Lupus Trust India was formed with the sole vision to provide relief and empathy to lupus patients across India through awareness, rehabilitation, and financial aid. We are presently a community of 800 plus patients across India. Our organization consists of patients as young as 6-year-olds to those like me who were diagnosed with lupus in their teenage, and those who are old and also middle-aged, up to their 60s and 50s. As we all know, systemic lupus erythematosus is a great mimic. Topping it is its invisible disability factors, leading to a delayed diagnosis and culminating in death. Equally worrisome is the catastrophic expenditure incurred by this health condition. It also poses a big question mark on the education, employability, and overall quality of life of patients. Our priority has always been to engage with the policymakers. We have presented the situation before the state government of Kerala, urgently pleading and appealing for the following: for lupus treatment in subsidized rates, medical insurance, and for lupus to be listed under the critical illness category, and especially the Patients with Disability Act. The above was presented in the Kerala State Assembly and is now in its final decision-making stages. We have also appealed to the Health Ministry in the center, pleading for a booster dose vaccine for the entire immunocompressed rheumatic community. Under the PARD, Patients Alliance for Rheumatic Diseases, efforts, activities, and planning, it's still a challenging vision to bring the rheumatic diseases under one umbrella and bring about change at the policy-making level. Indian Rheumatology Association support and guidance is of utmost importance to us, and I'm very grateful to them for continuing to do so.
Hello, this is Bhushan Ghati, and thank you, IRACON, for organizing such a wonderful program. I am Bhushan Ghati, Executive Coordinator, Ankylosing Spondylitis Welfare Society. Our organization is registered in Pune and caters pan-India. Even though it was registered on 22nd of January 2020, we were organizing seminars in Pune since 2018. Our focus is on spreading awareness, reducing delay in diagnosis, establishing referral pathways, and increasing research in this field. We also want to reach out to our female warriors and let them know we are a safe place for them to share their content and get the support they need. Hence, we have Prachi as our Prachi Bhosle as our organization's first president. We are active on Facebook, WhatsApp, and Telegram. You can contact with us through the details shared in the chat box. Thank you. Now I would like to invite Neetu to share about need for support group and challenges faced by support groups.
So before we have Neetu, Alakendu sir did introduce the Lupus Initiative Kolkata group, but I would like to call upon Dr. Argya to just give us a brief about this group. Dr. Argya.
Good evening and thank you, Dr. Vinash, for this wonderful session. So as Alakendu sir already summarized the concept behind the Lupus Initiative. So initially we felt the need like it has become more of a social problem than just a disease. So we need to remove those stigma from the social thing, and as other support group also mentioned, that we need a collaborative effort to make it an all the issues related like the medical facilities and insurance and all these things. So I think in future we should plan for a collaborative approach, and the entire idea to make them self-dependent. And many of the lupus patients currently work in our Office of Lupus Initiative, and they get paid from their those office, and we are trying to increasing all those things. Even some training program we are also planning in future, so that like they can be self-dependent and they can earn something out of their own skills. So all these things we felt very important to make them socially more competent. And again, those insurance and medicine and other things, we can plan to combine all the support group, and we can approach to different ministries and other authorities who can help us in a better way. And I think one of our lupus patients also has shared some video. I think Dr. Avinash is going to play those videos. So from that we can have their views regarding Lupus Initiative also. Thank you, and over to Dr. Avinash.
We still have a few more patient leaders who have to be introduced.
Hello, everyone. I am very grateful for the opportunity today. I am the co-founder of Stand for AS Foundation, and we started work on in 2016. There are three main focus areas that we are kind of, trying to work. First is, we want to create, awareness about ankylosing spondylitis in general population. Secondly, we are also focusing on reducing the delay in diagnosis for ankylosing spondylitis. And thirdly, we want to provide, relevant and important information to all the AS warriors, across the country. Though we are very active on social media, on YouTube and Facebook, our next big milestone is to have our own website, which we are planning to launch in the next year. And I want to again thank you for today's opportunity. I would like to hand it over to Neetu to take it forward.
Dear doctors, today I'll present to you a few aspects of the patient support groups which are not talked about often, especially for a country like India, where we are dealing with a low ratio of rheumatologists available to the population. Just yesterday only, one of the doctors who were presenting in IRACON, they commented that there is only one rheumatologist in a population of 2 lakhs. That is the ratio we are dealing with currently. So do we really need support groups in a country like India? So we at Scleroderma India conducted a small survey in the month of November 21, where the research participants number was 50, and it was a good mix of patients and caregivers with the age bracket from 21 to 65. Now I'll present a small snippet of the analysis here. So out of the 50 participants, 80% said they have better access to information to help manage their or their family members' situations. So the graph which you are seeing on screen, it is actually showing percentages. Now, 86% said that they have become stronger mentally after joining the support group. 90% said that the community feeling assures me that I'm not alone in this battle. There are people who are walking beside me. 94% people said that various lectures, presentations by professionals like doctors, yoga therapists, mental health professionals, art therapists, and whatnot have helped them to know and manage the disease better. So now this clearly indicates that the need for support group in India is the need of the hour. Having said that, we have always maintained that patient support groups are an extension of the doctor's clinic. Let's try to see what is our position in India. Where do we currently stand? So all esteemed doctors and my fellow patient group leaders might be wondering why my slide is not talking about our current position, but just showing a picture of tip of the iceberg. That's exactly where we stand as a patient support group, like an iceberg, which is a bigger, stronger body, but only the tip is visible to everyone. I would like all of you to hold that thought, why we are tip of the iceberg, till I move on to the next slide. Next slide, please. So now I'll talk about the challenges which are faced by patient support groups. This slide talks about the challenges collectively, not specifically about Scleroderma India, but from all the support groups. That's the reason I mentioned that we have touched only the tip of the iceberg in the whole domain of patient support. The first challenge I'm going to talk about is the need to get wider support from doctors across India, where patients are introduced to the concept of support groups. Though the support of doctors has started pouring in to all the support groups in the past 2 years especially, which is a wonderful start, we still have a long way to go. We have had various patient voices reaching out to us through other channels, which shared that support group mentioned was there during their doctor's appointments. Now, we would like to reach out to all the doctors and request all of you to, start keeping pictures, or, all support groups can collectively create an AV so that, even if doctors don't mention about the support group to patients, they catch the information from the AV in the waiting area. The other important and burning challenges between the GPs or orthopedics or dermatologists and other specialty doctors and rheumatologists. Now, there should be clean and clear referrals to the rheumatologist after the indications have been verified through various tests and channels that the disease is a rheumatic disease in nature. Most of the time, what happens is either the patient keeps suffering throughout the lifetime with other doctors or keep looking for other doctors since his symptoms are not being managed. Next major challenge we face as patient support group, that patients don't contribute back to the group. Now, I'll explain why it is important. A patient joins a support group and gets timely help from the patient leaders or other member of the group. Now, this new patient, over a period of time, has become a knowledge bank like other experienced patients, but they remain silent, non-active part of the group, and their contribution back to the group is nil or zero. Such scenarios put patient leaders in quite pressing situations, since the onus of supporting patients lies only with patient leaders, whereas in ideal scenarios, all should be willing to participate and take the load and responsibility off from patient leaders. The next major challenge we face is patients' acceptance of disease. Even doctors present over here would agree that once patient accepts their disease, the rest of the journey as a patient becomes easy. But in the absence of acceptance, patient's disease life cycle is quite challenging. Their self-worth goes down, morale goes down, and they start slipping into depression. We, as patient group leaders, counsel them, get them external help too, if required, but still it remains one of the challenging areas. Next slide, please. Now, there is another section of patients who have access to the internet. They have a smartphone, but they are not aware enough to look for the support group information online. So we lose those kind of patients because they never are able to reach for any support, medically or financially or anything else. The next section of people is those who don't have access to smartphones. We don't have any medium to reach out unless we start reaching out to all rheumatologists in India personally and create a support of some sort so that patients can reach out. So in this slide, I'm going to talk about how patients can be proactive. This is a very interesting topic as it brings patients in forefront. Now, patients can share their therapy has helped them or a doctor has treated them in a dignified manner and resolved all their queries patiently or any such varied experiences. Instead of sharing their experiences, they keep it with them. As a result, we are at a loss of information. Patients should be sensitized around this, that sharing their experiences might give huge help to some other group of patients. The other important aspect of the support group is patient participation. A lot of patients remain silent members throughout and talk only when they are in need, when they require some information. These people, when start contributing to the group, can become great assets. Next slide, please. The next thing by which patients can be proactive is by volunteering for support group activities, like organizing an event, sending invites, sending emails, following up with the speaker, or making some other arrangements. These are some examples by which patient participation can be a boon to the support group. Next slide, please. So far, I have collectively talked about support groups, their concerns, etc. Keeping that thought of working together with other support groups, I would now focus on the current slide, which talks about PARD. Now, what is PARD? PARD is a patient association for rheumatic diseases, informally formed in 2020 by all support groups present over here today and is open for other support groups for its association. We as PARD have collectively undertaken various workshops on various skills development activities. We organized our first webinar on 2nd October 2020 with eminent rheumatologists, out of which some of them are present here today. Next slide, please. We have also participated in a research study on disability by Vishesh, which is an organization working on disability inclusion. Few of us patient leaders undertook RTI training and filed a few RTIs to understand the state of rheumatic conditions in India in government hospitals especially. We collectively raised awareness about rheumatic diseases at multiple platforms, Patient Engage, ORDI to name a few. The other initiative we as PARD are understanding is advocacy, its issues, and we aim to bring advocacy to the front with awareness and supporting patients. Next slide, please. So advocacy, I've just talked about. So this was a short presentation about PARD. I would like to thank our IRA for giving us this opportunity to highlight few of the patients and support group issues. Thank you so much.
A very warm good afternoon to all of you present here. It's thoroughly an honor to be part of this conclave and meet all the lovely people here. And today we'll be discussing this very important topic of vaccine hesitancy. For starters, I'm a rheumatologist at the Royal Wolverhampton Trust in the United Kingdom, and also the chair of social media for Asia Pacific Rheumatology Organization. And besides helping patients with myositis and enabling them to support each other. So as we all know, it's been a very unusual last year and even this one with millions of deaths worldwide, and our patients were really impacted by logistic challenges. They couldn't get up the house, couldn't procure medicines. Nearly 1 in 5 in worldwide had these challenges, and just when we thought we were beginning to have a solution, the big elephant in the room today would probably be if vaccines are safe and not really COVID. So it's been a tough situation, and the widespread concern among our patients are COVID vaccines effective? Are they safe? And what if we took them? What happens next? So we all know that vaccine trials really did not include patients with autoimmune diseases. So there's really no data. Patients are worried about allergies and anaphylaxis, which they may be predisposed to, also adverse events, and most importantly, flares of underlying autoimmune disease. And there's a big gap in literature in this area that has contributed to widespread vaccine hesitancy. And this is what we saw as well when we surveyed nearly 16,000 people with autoimmune diseases, of which nearly 2,500 were not vaccinated. And they said that fear was the most common underlying feeling, and nearly 1/3 said they won't wait for more data before they can be sure of the vaccine. So looking at if you should take the vaccine, definitely the answer would be a yes, according to the CDC guideline. It says there's a 94% reduction in the risk of being hospitalized 14 days or more after the second dose begins to take effect. And if we were to look at the history of medicine and all the vaccines that are available to us, this vaccine does seem pretty effective, more than the flu shot that our patients are advised to take every year. So the Moderna and Pfizer coronavirus vaccines achieve nearly 95% vaccine efficacy, which I would say is really good, and it forms a good base to recommend you to take this. What if you're an immunosuppressant? Yes, that's a question most of my patients have asked me. I have autoimmune disease. I am on steroids. I am on other drugs. What happens? So people have looked at solid organ transplant patients. So clearly they're on very strong immunosuppression. The answer is yes, it might impact, but it depends on the level of immunosuppression you really are on. Patients with autoimmune disease, still nearly 80% of them do mount an immune response, and more data is emerging that even if they don't form autoantibodies, there might still be T cells protecting them from the virus. So the FDA has also authorized, based on this, that patients with autoimmune disease or immunocompromised individuals are eligible for a booster shot. And if you've not got one, then maybe it's time to go ahead and get it. Now, looking at the safety data from COVID vaccination in patients with autoimmune disease is a question which has been asked for long. And therefore, to address this literature gap, we conducted this patient-reported self-electronic survey. We published, tested, validated, and translated into 15 languages during the second lockdown period in India this year. And we included patients who were 18 years or older and recruited healthy controls for comparison. So overall, we had nearly 6,000 autoimmune disease and 5,000 healthy controls for comparison. And the adverse events due to vaccination were classified as injection site pain, major and minor adverse events, and hospitalizations. So our respondent population currently comprises of over 18,000 active vaccine respondents. It is a multi-center study where our over 100 collaborators have very kindly put us in touch with their lovely patients. And as you can see here, we have the maximum number of responses from Turkey at around 1,500, United States, Mexico, India, and the UK. And the first survey, we mainly wanted to look at the short-term adverse events after the vaccine, that is 7 days after vaccination, while we would be coming up with subsequent surveys to look at the long-term outcomes and flares after vaccination. So going through the data quickly, in the interest of time, we have nearly 10,000 respondents, of which nearly 3/4 are female and nearly half are Caucasians. And substantive number are also Asians and Indians. The median age is around 40 years, most from US, UK, and India. And nearly 2/3 of them were fully vaccinated, while the rest were partly vaccinated. We had an overrepresentation of myositis, a disease that I work closely with. But we also have many, many other autoimmune diseases, as we will see in a minute, and nearly 5,000 healthy controls. And we directly compared these with one another to look at the adverse events. And most of our patients had taken Pfizer vaccine, while some had nearly 13% and 11% to Covishield. Now, to simplify things, minor adverse events like injection site pain, or things just come and go, were seen in nearly 80%, but it was same across both groups, healthy controls and autoimmune diseases. But major adverse events were reported in nearly 33%. That is 3 individuals out of 100 had some adverse event. Now, this is a breakup of the autoimmune disease. If you're wondering which one you have, and if we studied that, we covered nearly all of them. So rheumatoid arthritis, patients with lupus, spondyloarthritis, Crohn's disease, thyroid disorders of autoimmune origin, type 1 diabetes, myasthenia gravis, pernicious anemia, and ITPs. We covered them all. And if we were to look at the major adverse events, then they were very rare. Only 4% of autoimmune disease patients versus 2% of healthy controls. And if you were to look at the individual adverse events, they were very rare, like 1 in 200 had throat closure, or hospitalizations were even less, only 0.7%. So sometimes there are differences in the baseline groups because the healthy population was also younger while the autoimmune disease were older. So we compared an adjusted analysis accounting for these baseline factors. And the good news is there was actually no increase in hospitalization in autoimmune diseases and absolutely no difference in the adverse events, both major and minor, which is very reassuring and tells us that maybe it's time to go get our vaccines for those who are waiting for more data. Now, the unanswered question after today still remains, is will your disease flare up? And there have been speculations around that. But we do understand at this moment that we can expect the unexpected with this virus, and more studies are needed to understand the long-term effects of viral infection, especially flares and the role of boosters. And for more data on that, please feel free to check out our poster being presented by Dr. Naveen R. And we hope to come up with more data with our subsequent surveys, so we'd be pleased to invite you to take those. But to conclude for now, vaccination does appear to be safe in autoimmune disease as much as in patients in healthy individuals. So please go get your vaccine today. And this is a lovely view while walking to work the day before. And I would really take this opportunity to thank the COVID study team for putting together such a brilliant effort and data for our patients with autoimmune disease. And of course, our lovely patients for taking the survey. Thank you very much.
Thank you, Dr. Latika. That was, I hope it's really helps our patients. And one question that I have for you as well as for Alakendu sir is, with this new mutated virus coming up, and I know it's probably too early, but are you getting questions from patients whether their vaccine will really work up with these ongoing mutations happening almost every 6 months. What is the situation in UK, Dr. Latika, and Alakendu sir, what is the situation in India? How many patients have approached you for this?
Yeah, in India, as is being reported till today, possibly 21 Omicron been identified, and in Kolkata, the situations are same as is happening throughout the country. The people are worried, but there are good supportive news are coming up that yes, the vaccine is working, and some of the papers are coming with support for Covaxin. So people who took Covaxin are very happy, and Covishield also they're having some support. So hopefully situation won't be so bad, and that will help as it's helping for the other variant. So that's possibly situation here in India and this part of the country. I think let's hear from Latika what is there.
Hello, warm good afternoon. And yes, the Omicron has definitely stirred up a lot of hopes for travel and everything. And even in the UK, the mask update is the mask advisory is back. So previously masks were not mandatory in open spaces due to widespread vaccination here. But now masks are back up, and I think it is advisable to avoid travel, and we are still waiting for more data from COVID experts. The advice is really to be more cautious. Of course, it's too early because it's just the genetics and the makeup of the virus that we've looked at, and we don't really have clinical data to back it up. And last, I think 2 years has really taught us that sometimes in vitro and in vivo can be very different. So we'll wait to see how widespread vaccine uptake, you know, the interplay of that and silent infections and the protection. We'll have to wait for more data to comment on that. But meanwhile, it's definitely advisable to stay safe and take the vaccine. So in the UK, it's also, they're expediting the boosters. So previously you were eligible for the booster only after 6 months since the last dose, but now you can take it even earlier. But I think we're lagging behind a bit in India on that front. So hope as the IRA can put together an advisory.
Yeah, that's an interesting, yeah, I agree. So in UK, they have made it compulsory now for these patients who are at higher risk to get booster doses.
So vaccination is always voluntary and by choice. So, but it is an advisory is out since earlier this year itself to get the booster shots. I think in August, the FDA had given out this advisory when initial data was from renal transplant recipients, where it said that the 2 doses were not sufficient for those on high dose immunosuppression. So only 40% of them mounted an immune response. Although our understanding is also evolving now, we know that sometimes there's no antibody response. There still might be some response, cellular response, but nevertheless, it is advisable to go for a booster, and all our patients here have had the booster already. But even for the general population, it is expected that there would be an advisory to be able to get the booster shot. You call it the third primary versus the booster. The booster is up to 6 months, which is for everyone. And the third primary is what all patients with autoimmune diseases were eligible for if they were on intense immunosuppression.
Right. So for the Hindi viewers, the जो टेक होम मैसेज है कि जिन्होंने अभी तक वैक्सीनेशन नहीं लगाया है, यहाँ पे तीसरी डोज की बात हो रही है। एवरीवन, आप सबको वैक्सीन लगाना चाहिए, और साथ में जो कोविड अप्रोप्रिएट बिहेवियर है, विच मींस कि मास्क लगा के रखना, खुले नहीं घूमना, इन सब चीजों का ध्यान रखना बहुत जरूरी है। So thank you, Dr. Latika, for your time, and we'll move on to our next session. I would like to invite Dr. Roy to introduce us and take us to the next session, which is about patient's perspective.
The next session is on patient perspective. This session would be done by Ms. Kirtida Oza. She has done an extensive research along with the doctors fraternity. Along with them, she has done a great research, and it was appreciated. Last time, in fact, she made a good presentation on that. She's a leader in the, she has got a deep engagement with the patient group, which we see in our group where the Sjogren's India, she has been very actively pursuing the help to the patients, and patients have been voluntarily looking forward to support from this group. Over to Ms. Kirti Davaza.
Hello, everyone. In 2012, I did the first session on patient's perspective at IRACON at Ahmedabad. And I'm very privileged to get an opportunity to do this again in 2021 because I think my own understanding of what is the patient's perspective and why it is so important in disease management has increased. So I'd like to share with you a bit about what I have learned over the years. And today, instead of a personal kind of understanding, I am happy to share the results of a small study that Sjogren's India undertook a few months ago. And that is what I will be sharing. As I said earlier, my role in Sjogren's India has been right from inception. I co-founded Sjogren's India in 2006. And one of the reasons that I decided to take on this is that in India, we did not have any support group for this condition. And patients were finding it extremely difficult to be able to understand the disease and to be able to talk to anyone. And it was extremely difficult for them to deal with managing this condition. And Sjogren's India provided them with the first platform for where they could talk about their worries, their fears, and the caregivers also talked to us. And we had a major program of understanding each other through patient education programs, through caregiver and patient workshops. We had interactive sessions, and now over the years with things going online, we now have a very, very active WhatsApp group, which has been a wonderful opportunity for patients to engage in conversations with each other and provide support to each other, talk about their fears, talk about what works for them and things like that. With that background, I'd like to start a screen share. Today, I will use the backdrop of the study that we did, especially for Sjogren's syndrome. I'd first like to talk about multiple perceptions that rheumatic diseases have. If you look at the slide in front of you, the word cloud will show you the different perspectives, the different perspectives about rheumatic diseases. When you talk to doctors, they talk about rheumatic diseases in terms of the diseases being complex, systemic, difficult to diagnose, chronic. So these are the terms they use. When patients talk about rheumatic diseases, they basically talk about how the disease affects them, whether it's a loss of confidence, whether it's pain, whether it's feeling lonely, feeling socially isolated, being tired all the time, suffering from brain fog. This is what patients' perception of the disease is. And when we look at what the patients experience from society, is that most of these diseases are invisible. And the problems that the patient faces are not very visible to the community, to their own families, to where they work. And they're often labeled as being lazy, weak-minded, shirkers, good for nothings. So the same disease generates multiple perceptions in different communities. The patients see the disease differently, and the doctors and society looks at things differently. I think one of the most important things is for all these groups to understand how the disease is perceived by patients and to be able to understand what is bothering them so much. Can we go to the next slide, please? Now, when we talk about a patient's perspective, why is it important? Studies have been done by doctors and by patient groups on why patient perspectives are important. And they have showed that patient-reported symptoms are often stronger indicators of the burden of disease and better predictors of quality of life as compared to the systemic manifestations of diseases. The patient actually experiences the disease on a day-to-day basis. And therefore, it is very important that their perception of the disease is also taken into consideration when we talk about understanding the complexities of rheumatic diseases. Patient experiences and medical knowledge needs to go together. Only when the patient and the doctor understand each other is when a successful patient-doctor relationship can be built. And this is, I think, one of the most important things for disease management. Patient perspectives are not only important for doctors to understand, but it is also very important for support group leaders to understand the patient's perspective. This is so because unless we understand what the patients are going through, how they are perceiving the disease, why is there a reluctance in taking proper treatment and follow-up, we will also not be able to provide them with the necessary support and proper strategies for dealing with their conditions. So therefore, it is very important to look at patient's perspective, and we can move on to the next slide. Although this slide is actually a part of our study for Sjogren's syndrome patients, some of the projections are valid for all other rheumatic diseases also. Let me not go into the details of what kind of study we did, except for telling you that the study questionnaire was basically an online study, and we did interviews and also did meetings with the group. And that was, so we did a bit of qualitative and quantitative analysis. It was a small study. And although we had more respondents, we were able to take 62 responses as being valid. Incidentally, the study is still open, and I would request patients to go to our website and still contribute to the form, because we are doing a second set with taking into consideration all the new material that we have, all the new data that we have gathered. Now, the reason I'm showing this slide is that basically the gender profile of any disease is very important for understanding how to manage the disease. Why I say this is because in countries like India especially, where the socio-cultural context is so important in disease management, we need to understand whether the disease is affecting women or men, and in what percentage. These are some of the reasons. I mean, gender is sometimes the reason for not being able to get a correct diagnosis, not being able to follow up, and things like that. So the gender profile is very, very important in a disease like Sjogren's syndrome, where the gender profile is 9 women to 1 male. A lot of these factors, cultural and social factors, have contributed to the way the disease is perceived, the way the disease is diagnosed, the way the treatment is happening, and things like that. Another thing that this slide shows us is that in India, we are finding that the age at which the disease strikes is perhaps a decade younger than the European cohorts and things. Scientific studies say it's a decade earlier. Earlier, it was believed that Sjogren's syndrome, for example, struck postmenopausal women. But now we find that that's not really true. In fact, in our study, 29% of our respondents were in the age group of 20 to 40, with a lot of them being in their 20s. Now, when that is happening, I think our strategies also need to change, whether it is treatment strategies, whether it is diagnosis strategies, and patient support strategies. When we are dealing with younger patients, their problems start much earlier in life, and the problems of socio-cultural associations, marriage, work pressures, all that gets compounded because the patients are much younger in age. This slide, again, the reason why it is here is not to show where we got our patients from, but basically to share that 42% of those who responded to the survey have been living with Sjogren's for 10 plus years. Now, that is a very encouraging statistic, which shows that this disease is not a terminal disease, as a lot of patients initially feel and fear. And this is also true for many of the other rheumatic diseases that we are talking about today. If treated, if diagnosed in time and treated properly, a lot of patients are able to lead near normal lives. The 16% patients in our survey were shown to have been diagnosed less than 2 years ago. Now, this is something that I'd like to point out to the patient leaders. This is actually the profile of those who need the maximum support. We have found that patients who have had their disease for over 5 years have basically learned to manage their conditions. And then they do not need too much support from the support group. But those who are young and new, young in the sense newly diagnosed is what I mean at this stage, not those who are only young in age, they need a lot more support in the initial years. So that is what I wanted to show in this slide. The impact on health. This is an interesting slide. I don't want you to get bogged down by all the numbers and figures here. These are symptoms and severity pertaining to a particular disease, which is Sjogren's syndrome. But what I'd like you to take a look at here is that while the most common symptoms that are recognized by doctors are, of course, there, it is interesting to see that patients perceived digestive issues, mental health, and gynecological issues as being of more importance than the lung, neuro, kidney, liver issues that doctors perceive as being very important. Whenever we go to a doctor, the doctor's first goal is to make sure that the vital organs are saved. So the doctor is focusing on the vital organs and damage to the vital organs. The doctor is looking at the life-threatening possibility of the disease, whereas the patient is looking at how the disease affects him or her on a daily basis. So I think that is a difference in perception, and somehow we need to find an indicator which accommodates the patient's perception of how the disease affects or impacts the patient's life on a day-to-day basis. So that was what I wanted to show in this slide. Can we move to the next one? Here again, basically, instead of dwelling on the percentages, I'd just like to point out that all the rheumatic diseases have a lot of comorbid conditions also. And the patient is dealing with not one, but several conditions at the same time. And that is something which affects the overall quality of the patient's life. So when the patient goes to the rheumatologist looks at the rheumatology part of the disease. When he or she goes to the other doctors, they look at their part of the disease. But this kind of approach is difficult for the patient because the patient is experiencing all the problems within his or her own body. And I think a better cooperation and collaboration between all disease specialists is very, very important for the patient to get a better quality of life. So that is what I wanted to focus on here. This is again a part of our study, but the impact on personal and professional life is very, very severe, whether a person is suffering from rheumatoid arthritis, ankylosing spondylosis, scleroderma, lupus, or Sjogren's. In our study, we found that 91% patients said that they experienced moderate to severe negative impact on their life. 37% showed negative impact on career, and 40% patients said that the family relationships and social interactions were negatively impacted by Sjogren's. Now, although this is a study on Sjogren's patients, I'm sure these figures apply to all other conditions also. And over the next 2 days, we will hear patients, we will hear caregivers, and they will be able to kind of qualify what I'm saying here in terms of figures and numbers, that the impact of the disease is very, very high on both personal and professional lives, on family relationships, on social interactions, and not only on education, but also on careers. Now, this is one of my favorite slides because it gives us a very, a picture of hope. Out of the 62 patients whose data we have looked at, 84% patients said that there was an improvement in quality of life over a period of time. Yes, initially, patients have a lot of problems. It takes them some time to get used to the disease, to learn how to adapt to it. The treatment takes some time to adjust. The doctors and the patients have to work together to find out a way in which the disease can be kept under better control. But this indicate the 84% patients saying that they experienced a better quality of life over the years indicates that early diagnosis, proper treatment, lifestyle changes, and a positive attitude can significantly improve the quality of life of patients over time. So with that encouraging note, when we go move to the next slide. So I'd just like to conclude with a few of the study findings, which basically show the patient's perspective. Perspectives on impact of diseases are different for doctors and patients. Symptoms which bother patients on a daily basis impact the quality of life of patients and are reported more often, as we saw in the earlier slide. We've also discussed doctors and treatments are focused mostly on organ or life-threatening impact of the disease. And very often patients feel very, very upset about the fact that they're non-serious. According to the doctor, the non-serious symptoms are often trivialized. They're trivialized by the doctors, they're trivialized by their own families, and therefore they feel very alone in their journeys. So we need to also consider that that has an impact on their daily life, and we have to learn to deal with it in some different way. Early diagnosis, proper treatment improves the disease outcome. Family support is extremely crucial for better disease management, and we'll see that in our future sessions. Workplace support and social acceptance of rheumatic diseases is very important for patients to be able to lead near normal lives. A lot of the patients have had to give up their career options because they were unable to find that workplace support. But I think now if all the rheumatic diseases people get together, we'll have a large enough lobby to talk about how workplace support for people with rheumatic diseases with invisible disabilities can be supported. And I think this is a very important thing, considering that now younger patients are getting afflicted, and we really need to focus on this part of dealing with patient support. This is just a general learning and recommendation slide where most of the awareness and what we need to do at various levels is very well known. So let me not focus on that. But I would like to point out a few of the things that clinical research for better understanding of the complexity of rheumatic diseases, especially of unexplored conditions like Sjogren's syndrome, is very, very important. Although Sjogren's syndrome is considered to be the second most prevalent disease after rheumatoid arthritis, we all know that it is one of the most neglected of conditions, and it is most unexplored, and patient experience is highly undervalued, and therefore a lot of the complexities are not even recognized. So I think we really have room for improvement there. We have no targeted systemic treatment yet for Sjogren's and for some other rheumatic diseases. So that also needs to be improved upon. Another very important thing that I feel is we need disease-specific guidelines for India, because as I said earlier, the socio-cultural aspects and other aspects of how patients, how that contributes to the disease management also needs to be taken into consideration, and therefore we need guidelines with India focus for each disease. We need to work on the recognition of invisible disabilities caused by rheumatic diseases, and therefore work for provisions on reasonable accommodation at workplaces. And another thing that I'm very glad we are talking about tomorrow is the health insurance and financial benefits for chronic complex conditions. And that is something that we really need to work on as a collective of doctors and patients together. So with that, I'd just like to end with saying that rheumatic diseases are not given any importance in the disease management. You know, when you have so many serious diseases which need focus, rheumatic diseases are fall way behind. In fact, when we did our RTIs, we realized that we don't even exist in any of the records, whether it is non-communicable diseases or anything, we don't exist at all. So greater attention needs to be given, and we need little, but we need that little very much. So if we need to improve the quality of life with people with rheumatic diseases, we need some attention from all these people. So with that, I'd like to end this presentation, and thank you all for a patient hearing.
Thank you, Kirtida. So, काफी सारे important messages, not just for healthcare professionals, something like कि हमें patients के साथ ज़्यादा time spend करना चाहिए, चाहे हम कितने ही excuses बोलें कि बहुत patients हैं. This is something very important, and also it is important to understand जो कीर्तिदा ने बताया कि non-serious symptoms जो कि daily life पे impact करते हैं, something जिस पे focus करना जरूरी है, और वो तभी हम कर पाएंगे अच्छे से अगर हम ज़्यादा time देते हैं तो. And Indian specific guidelines is something very important, and for patients आप लोग को ये समझना जरूरी है कि near normal life achieve कर सकते हैं. अपना टारगेट रिवाइज करिए, इंस्टेड ऑफ 100% अगर हम 80 या 90% पे अपने आप को लेके आते हैं, हमें खुशी मिलेगी, we'll start feeling happy, and quality of life would be better. And I'll also take up one of the questions जो Facebook पे पूछा है about curable versus treatable. तो that's a very, एक straight answer नहीं है. जब भी हमसे patients पूछते हैं तो we tell them about, like Kirtida had told, it's all upon, depends on early diagnosis. जितनी जल्दी हम diagnose करेंगे, जितनी जल्दी हम treatment लेंगे, विश्वास के साथ treatment लेंगे, तो हम चीजों को काफी अच्छा हद तक control कर सकते हैं. कुछ disease पूरे ठीक हो जाते हैं, कुछ disease थोड़े बहुत fluctuations रहते हैं, जिसके बारे में हम कल भी सीखेंगे. So with that, now again I'll call Mr. Roy to take us to the next session.
And I invite Ms. Neetu Wadhwa to discuss on that topic of caregivers perspective. Welcome, Neetu Wadhwa.
Thank you, Mr. Roy. Thank you, Dr. Avinash, for inviting me to present the challenges faced by caregivers of rheumatic diseases. Or why do we call the disease not only the disease of the patient, but it's a disease of the family. I will share a short story with all of you present here. That story is of any rheumatic disease patient's family story. That story is actually my family story. When I was diagnosed and later I started using oxygen, ever since then, my family has not taken a single vacation. Not only because I can't travel, but there are other reasons too. Because my parents feel obliged to support me physically and financially. The same sentiments are shared by Vachas Amrita's parents. Vachas Amrita is a trustee of Lupus Trust India, Kerala, and one of the youngest patient support group leaders amongst all of us. So now let's watch Mr. and Mr. Saiju's journey as a family. Video, please.
Very warm greetings to all the esteemed doctors,
yes, please.
The patient leaders, patient groups, and all the wonderful patients and viewers. I'm thrilled and grateful to Indian Rheumatology Association for my family to talk about handling juvenile lupus and the familial and the parental aspect of it. So I'm thrilled I have managed to get my parents to do this today. Both of them were working, so I got them to record this video at 2 different times of the day. And I hope this video is helpful and helps you as patients, as everyone connected to the patient and related to the patient, to handle and battle lupus and other similar conditions like a warrior.
So Vachas wants me to tell how I felt or how I reacted internally when I knew about her, the diagnosis of her disease or health condition. Well, to start it on a lighter vein, I was, Vachas Amrita's dad, Saiju, took me to a restaurant over a banana fry, and when he divulged the diagnosis of Vachas' health condition, I was not, I was not despondent. So you'll be surprised. The reason is ignorance is bliss. I've never heard of such a jargonized term like lupus systemic, lupus erythematosus. Initially, I did not know the seriousness. So these questions we have never asked because we knew it's a disease which is not like a fever. Okay, you take a dolo and you say, okay, 2 days will be all right. You can, get off to your work. So that acceptance of the disease immediately gives you entire strength. And you might even overcome the situation, or for all what you might. I don't want to say that I was a super mom. I was very despondent. Sometimes I've broken down. And always I've been anxious and depressed sometimes. But her disposition, Vachas Amrita's disposition also, I think other patients can emulate. She had a tremendous fighting disposition. I've never seen her depressed and, oh, I got a disease. So that type of designation she has never given to her, that she's a diseased person. So when you designate in the other way, I think things happen in that way and your way of life all will be like a normal child. So she traveled, I think more than a normal healthy child. She worked more than age, or people of her age will do with our company. of course, dad has a very particular, very specific disposition to a fighting spirit, and giving that training to her daughter, which helped me immensely. I also benefited from that association. So
that's a very tough question, because you're asking how I have processed this. Well, normally, all these are all information, right? That that you have lupus, and you're going to, it's affecting the kidney, and you are in great pain. Processing this is based on our maturity, how mature, how well we can handle these things, how we can philosophize these things, how we can take very definite steps. So I think my mind was aligned in that direction, that is in how to change my outlook, keep myself strong, but and how to support you in a manner which is which would be most comfortable for you. At the same time, keep that drive in you, that you despite the difficulties, you have some aim or goal or purpose in life. So all these were the considerations that I have had in my mind. Yeah, so the journey is going to get tough in everyone's case, right? For example, old age for a person is actually a journey which is getting tougher, in terms of physical and mental. But one thing I must say, that I had imagined the condition of those who do not have that kind of money to give medical support to their dependents. Compared to that, I must say we were very, very fortunate, feel grateful for that good side of it. So then the second part is, once the financial part is done, then the other part is coping up with the pains and the difficulties of the person who is having sickness, and those who are very close to the person, the patient, who are emotionally and physically supporting them in close quarter. As far as they are concerned, I think it's a transformation which is required from inner transformation. That is, we look at it as a part of life, and celebrate what is good despite all this. There's not many good things that are happening, and if you really look at it another way, we might think, oh, all others are, compared to this person who's having sickness, others are really enjoying and life is better. Is it really so? I doubt it. I think everybody has their fair share of misery and happiness. I felt that it is a matter of training ourselves to celebrate what is good within us and with this world. That is more important, and that's a matter of training. We have to learn, and we have to train ourselves to do that repeatedly. We as a group have realized that to that extent I felt peaceful and happy. It's a decision that we take to be happy. So that doesn't mean that the situation will change, and today you may be doing good, but tomorrow there may be a problem with the kidney, especially for lupus patients. We don't know what part of the body is going to get affected, and for a lupus patient also there could be accidents on a daily basis or a weekly basis or a monthly basis, but we are not living a life worried about accidents all the time, right? That make us paranoid. There can be a lot of fun even while there is an organ is affected, or you are repeatedly getting admitted in the hospital. Still in those situations also there can be a lot of fun, a lot of jokes, a lot of music, a lot of discussion, philosophy, ideation about work, ideation about future plans, travel. So I feel that for this sort of diseases where you chronic ailment where you are going to live with it for quite long time, maybe a decade, 2 decades, maybe lifetime, this should go into our head that create moments within, and that's what everybody has to do. This sort of diseases teach us that yes, we need to take a decision that yes, I'm going to find happiness.
So I've heard of the saying that in going gets tough, the tougher gets going. So I never thought that it will happen in my case too. I understood that I'm a tough mom. And yes, the patient, that is Vachasamrita's mental disposition, and her dad's disposition also has immensely helped. He also is a person who doesn't lament, who only takes steps which helps, doing the needful, not doing the best. There is a difference between doing the needful and doing the best. So when I see the atmosphere in the whole ambience in the family is, doing the needful without lamenting. So it has helped me to cope up as a mom in all the situations where, unexpected hospitalization and new medications one after the other, and these uncertainties still kept coming up, and it might come up in future too. So there should be a philosophical disposition of the mind. This is very important. You cannot create something artificially in a sustained manner. Maybe one moment you may be philosophical and say it's all okay, but to maintain and sustain in the long run, you should have a deep philosophical conviction, or you have to cultivate that conviction that when things are beyond your control, you have to take one thing at a time. So this is what I have understood. And secondly, we don't, the vibrations, when we say something, that creates an impact on the hearts of others. So what we say about the disease, how you present it, how you react to a particular situation, like when unexpected some health conditions happens to your daughter or son, how you react, not in alarming way. So these things are very important. So you yourself learn various life skills. You have to learn. This is mandatory. So learning the life skills, like expressing things in the most befitting way, which will not put the patient, your daughter or son, in a more difficult situation. So these things you will learn. You will have to learn. So I also have learned. I was not like that. So this is very important, how every moment there should be a spontaneous consciousness, knowing that you have a child, daughter, who is coping up with a very difficult situation. So you also have to be you have to bring a situation which helps her to cope up. Thank you.
I would like to really thank the doctors, some of whom I've had the immense pleasure of collaborating with for awareness activities and various other webinars. Thank you very much.
So this video of Vachasamrita clearly shows no matter how strong patient leaders we are, the same issues affect us too, as like other patients, which actually people tend to forget. Thank you, Mr. and Mr. Saiju, for opening your heart and talking about your most precious gift from God. So while I was talking about my parents' journey, the other challenges they face is they have not gone out to movies, malls, any social event. They have to plan a lot, since accessibility for me is not visible in all these locations, even on a wheelchair. And they want me to be part of all the experiences they are having in life. So they make a conscious decision that they will also cut down. I can well imagine how they and other family members feel obliged to help us, support us by making lifestyle changes, which is commendable. It's not only physically my parents are constrained, financially too, every decision in the family has to be considered keeping my condition in mind. For example, pretty recently, I was asked to look into lung transplant for my ILD and PAH condition. We all know how challenging that decision is, not only emotionally, but financially too. I was able to go ahead and start on this path only because my family changed their priorities. They updated their financial plans and created an option financially for me to consider this decision. On a similar note, Harpreet, who is from Punjab, which is actually our wheat belt of India, had to make adjustments in her life to accommodate her brother's health condition. Her brother also had to take a lot of setbacks in his career and personal life because he also is having ILD and breathing issues. Harpreet's video, please.
Hi, my name is Harpreet. My brother is suffering from scleroderma since 2003. I am here today to talk from the perspective of a caregiver. My brother was, and we can say still is, rock or pillar of the family. He is working at a respectable job in a central government, but unable to cope up with his job and will have to take premature retirement. He was a renowned national hockey player and best athlete till 2003. It is very painful to see him exhausted, even after a little walk or work. My parents are getting older day by day and needs help in daily activities. My brother gets disappointed, finding himself unable to take care of them. Seeing his pain, both mentally and physically, my heart bleeds, and I get very dejected at times, but I have to keep a brave face for him. This disease was something we had not heard about it. It took a lot of efforts and time from my end to understand this disease. The patient goes through a lot, but we as caregivers go through twice. He was a dreamy, ambitious boy. He did not like to take rest during the day. He did not like lazy persons. But now he gets depressed as he has to stay in bed throughout the day. His wife is also suffering as she has to work at home as well as in school. She has to take care of family and children. I am married and have children. I also face lot of problems taking care of both the families. Sometimes I cried loudly and complained to God. His children are also suffering. It becomes difficult for us to make them understand that we need to plan our day activities around him. We need to plan our outings in a manner where someone can stay with him as he is on oxygen requirement. It is very disturbing to see such a different person that what he was. The transformation is like night and day. We don't have answers to a lot of things. I ask again and again this question to God, why he? We can't change anything. But I try to console him by telling him there are so many persons in our world or even in India and Punjab who are suffering from the same disease. I try to make him console or motivated to fight with this disease by making him listen so many motivated stories from the book The Power of Subconscious Mind and the book Secret. I pray to God every day that no one else is suffer from this kind of disease. We can't do anything, but we have to stay motivated and make them motivated also.
Thank you. Thank you for that. Thank you, Harpreet. You have been a strong pillar, not only for your brother and sister-in-law, but for other family members too, including your husband and children. You have actually shown, how caregivers are always ready to help, to reach out, and they are ready to change their lifestyle. All these family members, including mine, like Achas, Harpreet's, mine, have adjusted their life around the patient now. And the patient is the central focus of the house, which is more than commendable on the caregiver's part. Now, I would like to move over to the next session of the evening and hand it over to Dr. Avinash. Thank you.
Welcome to another session on day one. And the focus of this session is on research in India and what role patients can play. This is something I would say is very relevant because obviously we have a big population, and there are multiple ways by which India can contribute to science and help in improving research, not just in India, but all over the world. And I have the pleasure of introducing Amita ma'am. She has been my mentor and teacher at SGPGI and has imbibed this culture in us to not just take care of patients, but give back to society through science, through research. And we also have Mudita. She's a lupus warrior, and she has also agreed to take part in this session. So without wasting much time, I would first like to request Mudita to introduce herself, and then Amita ma'am.
Good evening all. I'm Mudita from Prayagraj. I'm in teaching profession. I am teaching computer science in a university in Allahabad. I'm a lupus patient, and I met Dr. Amita at SDPGI Lucknow. And then I also have an urge like patients must participate in such a way so that we can aware other people to early detection of any disease. So like ma'am when asked, then I volunteer myself for this session. Thank you.
I'm at SGPGI, and I have passion for lupus, and I've been seeing patients with lupus since I think 84 or even earlier when I was at All-India Institute. And I feel that as a physician, our job is not only to treat patients, but also to make them acceptable in society, make them useful in society, and in turn, encourage them to help the society look after this disease. So that is why I've been trying to make patient groups where patients can interact and solve their own problems. And a lot of problems can be solved by patients themselves. So thanks to Avinash for inviting me here.
Thank you, ma'am. Thank you, Mudita, once again. So let us start with some of the questions which, are often, they come in our mind and even patients' mind and even a healthcare professionals. So Mudita, we'll start with you. Do you think research is useful? And if yes, what is your take on that?
Yes, research is definitely useful. Like in present scenario, we see that COVID has come and we developed the vaccine just by a quick research, and we have implemented. So we are doing far better than other country now in our country in terms of patients' death and all. So definitely research is very important to do modification, come out with good drugs for the better patient recovery. Definitely. And I'm very thankful that I am part of this as I volunteer myself as when ma'am asked.
Right. That's great. That's really well said. Ma'am, do you think that, Amita ma'am, do you think that a patient who is participating in research, does the research help him directly or indirectly?
Research definitely helps future patients, because when we start research, we have a question in mind, and it may or may not affect the patient who's participating in the research at that time. But I feel that the patients get some indirect benefit definitely, because when they do participate in the research, they also have a feeling that they are doing something for society. So that gives them a positive thinking. The second, it has indirect benefits, like we see those patients out of turn, we give them a special status, so they have more organized care, they get more education about the disease, And sometimes they have even access to costly drugs, which are not available in our country or the patient cannot afford. And furthermore, some tests which we normally don't do are done for those patients. And in some cases, we can also give them treatment for some abnormal test. And finally, which we don't do in our country, but in other countries, patients also get some monetary benefit for participating in the trials, which our country feels is not a good thing. So we have not encouraged that.
Yeah, I also agree with your thoughts. And in fact, on one of the occasions, one of the patient relative was saying कि doctor साहब आपके messages का भी reply कर देते हैं. You must be participating in some research, which I agree is, we tend to develop that bond also with these patients because they're always there with us. They come regularly on follow-up. That's how we encourage. So Mudita, tell me, I think you have already mentioned you did participate in research, but were you approached for it? When was it? And how was your experience?
Actually, I was, when I detected this autoimmune disease, so I went to SGPGI and thankfully I met Dr. Amita ma'am only. So she said ki, she detected my disease after some time when I keep on going for follow-up. So she said ki, we are doing one research project, and would you like to enroll in that, because you have to keep a regular follow-up, and like for the sample and all, you have to agree when we ask for the sample. So I said I definitely participate in this because it will be beneficial for others in coming future. So
That was
definitely
really,
one should volunteer.
yeah, no, that's good. That's really thoughtful of you, and to agree. And this is what we also would want all patients to understand, this, that it is very important, and a few ml of blood from your pool of blood will not result in
nothing.
that is it. And did you, even after when the disease was diagnosed, you came to know about research opportunities, did you on your own try looking up for other opportunities or what is happening in the research world? मतलब क्या आप इस तरह का homework या कभी कुछ किया है? Did you ever Google that?
No, I never did. But like I have this, ma'am, we should spread an awareness so that this disease be detected early. So ma'am, then let me know. I said we can now do digitally also. We can make some in online world. We can impact more people. So ma'am also told me that they are creating one group, and she added me there, and we started nurturing others, and so that they also come to know about this thing early, so that they should not fall under the consequences of the severity of this disease.
Yeah, I agree. That's important, because spreading awareness about disease will also help them understand what the disease is about, and then they can probably actively participate in other activities associated with the disease. Totally agree.
Because generally what happened with the patient, ki thoda milta hai, then they leave it. And then they don't follow it, medicine and other things, and then later on again they get some or other thing.
Yeah. This chronicity is a big challenge for such autoimmune diseases.
Yeah. Yes,
Amita ma'am, what are the challenges have you faced as a researcher as far as participants are concerned? What problems do you generally face?
Major problem in a study where you are going to do suppose a drug trial, and you tell the patient that you can be either in the drug or not in the drug group. So the patients find it very difficult to understand that why should I not be in the drug group? Because everybody believes the drug is going to work. While we tell them that we don't know if the drug is going to work or not. So this concept of equipoise is very difficult to understand for patients. The second, the need to have a regular follow-up. As Mudita just now said, that as soon as the patient gets well, patient feels why I should go again and again.
Yes.
Then the need for giving blood samples. In the beginning, everybody is very positive. But when it comes to repeated blood samples, obviously I can understand. Nobody wants a prick. And it's only the pain of the prick. But still, it is understandable. But for research, we need to do something in the blood sample. So we need the blood sample. So we are trying to do studies where we don't need blood sample also. The third is that there are some instruments or some things which we measure, which our patients find it very difficult in India to understand. Like we ask them, can you grade your pain on a 0 to 10 scale? They will look at you absolutely blank. You tell them, okay, 0 means no pain, like me, I have no pain. 10 means patient who has an accident, who's crying in pain. So in that scale, what is your pain? So patients in our country, we are not taught abstract thinking. So they will say, from the last time, I am 50% better, but they cannot say at this time, what is their pain scale. The last, which is most important, is compliance with drugs. Invariably, about 50 to 60% of patients will down titrate their drug. They think that this drug is not needed, or I can reduce the amount. So that are the challenges which we face as researchers. But I feel still, if you keep constant contact, you call them up, you send a WhatsApp message, you are there available with them 24/7, you can improve upon all these things.
Yeah, I agree particularly with that lack of abstract thinking, where जब हम लोग पूछते थे वो बोलेंगे बीच में लगा दीजिए डॉक्टर साहब कहीं बीच में 5 पे 4 पे something like that. So that's a challenge. But then that will probably not also help them understand their disease. Okay, there is something scale with which we can compare. And so Mudita, back to you again. Do you think, or were you ever scared on the first time when you were asked or told something about research? And do you think patients get scared? And why do you think that might be the reason?
Maybe patient get scared, but I didn't because I have this approach like how we can help the society. This thing within me also.
Right,
so
right.
somehow when ma'am asked, so I said, okay, yes, I will do, because definitely we can if something good come out of it, future generation will get help
Right.
of this. Yes.
Right. Yeah. Yes, I also agree that
Generally people get scared. They try to get away from medicine and other things also. So and they think unnecessary, why to involve in this stuff.
Right. हमारा कुछ ले लेंगे kind of fear is there at times.
ऐसा कुछ
But
भी
then
नहीं
I
लेते हैं.
but
ऐसा
then
कुछ
I
भी नहीं
agree.
लेते
Yeah.
हैं.
The point that you mentioned, if we persistently, educate them and tell them, then probably they would understand. It's just that we need to spend time. The only problem is with that busy OPD, sometimes it's difficult. And I remember Amita ma'am had suggested me कि research के लिए समझाने के लिए, it's always good to have another day, spend some time with the patients, and then it's always
also education and nurturing
exactly
is
totally
a
agree.
very essential part.
Right.
And like this disease has symptom like this, nobody can understand, like joint pain, mild fever, fatigue. So they think ऐसा तो सबके साथ होता है.
Right.
Nothing special. और
Yeah.
why these doctors are unnecessary making us scared you are having something different. It's not a regular fatigue or fever or pain.
Yeah. That's another dimension to the disease, the symptoms which people don't see from the top, and then they feel what is happening. So my final question for the session would be for Amita ma'am. How has management changed over last decade in as far as this so-called research is concerned? How has that helped so that patients understand what has researched which was done maybe 20 years ago is helping them now? That is what probably helped them understand if they contribute, they are doing it for their future generation, because it's a long battle, it's a long disease. So how has management and prognosis changed over last, say, 20 years?
Avinash, Mudita just said that COVID-19 is the best example.
Right.
And this mRNA vaccine has not come in one day. People were trying to make mRNA vaccine for the last 10 years, and it had never been experimented out. And here there was an opportunity because of the pandemic. And see how much success has come out of this mRNA vaccine. Same way, adenoviral vectors. I mean, they had been tried only very few cases. And now we have that vaccine, which we are all of us have got Covishield. So I think this is a prime example of how research done in the last 10 years has helped mankind in a pandemic situation. And you could get a vaccine in 10 months. Like, it is unheard of.
Yes.
If you take example of lupus, in lupus, we didn't have much drugs. When I trained, we used to just give cyclophosphamide, corticosteroids, and Chloroquine. We didn't even have hydroxychloroquine in India. And as you know, hydroxychloroquine got licensed in 1957 for lupus. And after that, it took 50 years to get the second drug license for lupus, which is still not available in our country, belimumab. But now, because of so much of research, we have 2 drugs coming up with this year, voclosporin and anifrolumab. So you have even managed to get a drug, an oral drug. And maybe in soon, we will have more drugs, which will be acceptable to our patients, which will be cheaper, that they will be tablets, which can be given. And outcome of lupus has really changed in 50 years. But the disease which used to kill has now become a chronic disease. It doesn't kill now anymore. Very few patients, maybe 5% or 10%, will die. Rest of them will live with it and live more comfortably than what they were living 50 years ago. So I think it has made a marked difference to lupus. Patients have become much better. Quality of life has improved. Their survival is improved. Their organ damage has improved. But we still have a long way to go. And that is why we need to do further research.
Right. Yeah, totally agree. Totally agree with the how things probably people have best understood it with COVID. How such stupendous research has really helped, such amazing work. And so, yeah, that's how hopefully most of you who are watching must have learned that research is important. You should actively participate because, books can only teach us to a certain extent. हम लोग जो आपसे सीखते हैं उसको औरों पे apply करते हैं. There is nothing like that. So if this research becomes a habit, it will be great. And this also gave me an idea if our websites and our web pages too should have sections where they talk about research. What is the importance of research? What research will do? Because if people Google up and read about it, they will realize the importance of it. So thank you, Amita ma'am. Thank you, Mudita. It was a very good session. Thank you for your time. Amita ma'am, there are few questions, but most of them are around, are there no drugs that can, cure the disease? So can research help us achieve that level, achieve that target? And
yes. If you see hepatitis C virus, it came during my lifetime. And we thought that hepatitis C virus would never be cured. And now you have drugs, which is giving you a cure rate of 95 to 97%. And it is being thought that in the next 10 to 15 years, we will wipe out hepatitis C virus from the whole world. So even in my own lifetime, I have seen this. So we always have to be hopeful. If we do research in a proper way and we are able to hit the targets right, we are hopeful that in autoimmune disease also we will get drugs where we will think of cure, not suppressing the disease.
Right. Yeah, I think that's a wonderful example, and I hope आप लोग सब आगे बढ़ के रिसर्च में पार्टिसिपेट करें. और ये सेम वीडियो हमने हिंदी में भी रिकॉर्ड किया है क्योंकि आई कैन अंडरस्टैंड बहुत लोग इंग्लिश नहीं समझ पाते हैं, तो उसका लिंक आपके फेसबुक पेज और यूट्यूब पेज के नीचे हम आपके साथ शेयर कर लेंगे. एंड थैंक यू मुदिता एंड थैंक यू अमिता मैम फॉर ज्वाइनिंग. Mudita, if you want to, yeah, thank you, ma'am. And I would like to invite Ami to conclude, and we hope to see you all again tomorrow, same time, 7 p.m.
Thank you, Dr. Avinash. Hello, everyone. I am Ami from Antardwani. We are a support group for ankylosing spondylitis patients. This was indeed a wonderful session. We got a lot of understandings on new things about different support groups as well as the disease. First and foremost, I would like to thank IRA, that is the Indian Rheumatology Association, and the president, Dr. Alkendu Ghosh, for including all the support groups at IRACON. I would also like to express my appreciation to all the speakers and patient leaders for their support and contribution and explaining us about the role of support group, its need, what were the different patient perspective, and what is the impact on rheumatic diseases on the caregivers. It was the wonderful insight about the vaccination from Dr. Latika, and we understood the importance on rheumatic conditions and the role of patients. Hence, it would be really nice for all patients to participate in the ongoing researches as explained by Dr. Amita. Thank you, Dr. Amita. A big thank you to Dr. Avinash and all the people involved in the program. Lastly, a big thank you to the technical team for their support throughout the program. And as Dr. Avinash said, we all will meet tomorrow, 7 p.m., the same time. The agenda for tomorrow is delay in identifying rheumatic conditions. What are the symptoms and impact of the disease on life and the finances? Thank you, everyone. Have a good day.